Greetings, friends and followers. This is Nurses Talking. I am Dale Barzi. As always, if you like what you see and hear, leave us a comment, subscribe. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students to retirees and anywhere in between. Today, my guest is Jadesola Arolowo. Jadesola is a registered nurse in Nigeria, and she graduated from university over 3 years ago. And since then, she has worked in various settings, both acute settings, both in private and teaching hospitals. She currently works as a surgical nursing officer, and she describes herself as a compassionate, hardworking, kind, detail-oriented Christian lover of God. She is a writer and content creator. She is the founder of My Child and I, an initiative birthed in 2021, whose aim is to contribute to the reduction of maternal and child health mortality rates globally through education. She's also a podcaster and a teen coach. Welcome, Jadesola.
Thank you very much, Ma. It's my pleasure to be here.
It is my pleasure to have you, truly, Jadesola. So, tell me, what brought you into nursing?
Yeah, I didn't always want to be a nurse. Growing up, I developed the flair for caring for people, and I just thought like I wanted to be in the health sector, and medicine was the most probable choice. And this desire was fueled by my dad's passion for medicine. So yeah, medicine it was. But after graduating high school, I had to go through a pre-degree program conducted by Obafemi Awolowo University, which was a 9-month program helping students to come into the university. So after that 9 months, I finished with a score of 77.7%, which was not up to the cutoff for medicine, which was 80%. So yeah, I knew it had to take a miracle to enter into medicine. I got into nursing, which was a 5-year course, and I finished in 2020 precisely. And so far, it's been amazing. Yeah.
I like that word you used, amazing, because nursing really is amazing.
Yeah.
But you mentioned that your father had a passion for medicine. Is he in the healthcare field?
No, he was not. His dad was kind of healthcare related, so he wanted one of his children also.
Got it. So, having gotten into nursing school and now that you're a nurse, what are some of the challenges you encounter?
Yes, daily nurses have to deal with patients, and we interact with different people, the multidisciplinary team, doctors, physiotherapists. And since you are the closest person to the patient, you always have that kind of rifts and conflicts. You always have to deal with different patients with different personalities and attitudes. Some never get satisfied with the care that you give, and that could be a kind of challenge. But I've learned to always deal with such situations using emotional intelligence, de-escalating issues, and just trying to understand their point of views and prefer solutions in that moment. So yeah, that's one of the challenges. And also in Nigeria, we don't have so much resources, and the facilities can be inadequate sometimes. And so you have to make do with what you have. And yes, so that could be a challenge, but we get through it, yes.
Yeah, I could see that. But also, that challenge kind of forces you to be very innovative.
Yeah, yes. You have to like improvise and think of what you can do with what you have at that point in time. Yes. So it makes us to think.
So you are, from my perspective, you're a baby nurse. You know, you've been this is 3 years on. For me, it's 49 plus. So from my perspective, you're a baby nurse. When I look back, I see a lot of change, many changes that have taken place over the course of my nursing career, especially in the last decade or so. When you look forward a decade or so, what would you like to see?
Yes, I would like to see more improvement in the nursing curriculum, because over here in Nigeria, we do a lot. The nursing program is rigorous and intensive. You take courses from different departments, philosophy, even departmental and faculty courses. And so it can be very burdensome trying to cope with that level of nursing courses. So yes, going forward, I would like to see nursing curriculum more centralized and focused on what exactly we need. Yeah, what exactly we need in practice. So yes, I'd love to see that, and also an improvement in nursing remuneration. Yes, in this part of the world, nurses are not so appreciated. Yeah, but I think going forward it will get better with better attention given to the health sector. So I love to see that, and more innovation in nursing. Nurses are very talented, and if only we can tap into that resource that we have and engaging technology to bring out more innovation, going to telehealth. Yeah, we know that telehealth is becoming rampant these days, but I foresee that it will become even more rampant in the years to come. Yes.
Yeah, it's very all of this technology from my perspective is very exciting. Being able to reach people that just because you're not in a physical presence doesn't mean you can't reach them. So being able to reach people that way is very exciting as far as I can see. But for you personally, so for that is for nursing. What about what you personally, where do you see you in 10 years?
Yeah, I see myself climbing the professional career, the professional ladder in nursing. I believe that as a nurse, you are not limited and you can diversify into different specialties at any point in time. You can always try this if you feel like you want to see what it's about. And I just really see myself dabbling into different specialties out of the shores of this country, being exposed to what nursing looks like in different countries. Yes, so that's what I was saying.
Awesome. And so you have founded two, not one, but two organizations, right? You
Yeah.
founded My Child and I, and you also founded Called Out Tribe. Right. So let's start with My Child and I. What started you on that path?
All right. So in 2020, after graduating, when COVID started, we were all at home. And before, we hadn't gotten inducted into the profession at the time. So I just wanted to get something doing. So I got to a nearby hospital to just volunteer my skills. So I found out that there was rampant lack of information. Like there was a knowledge gap between women of reproductive age, pregnant women coming into the hospitals, and when they get assessed by the doctors and see that they can't give birth vaginally, like through the spontaneous vaginal birth, and there is an option to go through cesarean section. Many of them found it like a taboo. Like it took so much process. Even their families didn't want them to go through. I've had a situation of someone leaving the hospital saying they can't go through cesarean section. It's either the normal vaginal birth or nothing. And I felt like if such a person was educated on the fact that cesarean section was also a mode of delivery and not something that was a taboo, I think they would have made better decisions on their own. They would have, because they are informed better, they can take better decisions. And also some pregnant women came in and something had happened before they presented. They probably had a fall and it led to the death of the baby later on. That could have been prevented if they knew they were supposed to come at any slight thing that they felt or any strange thing happened. So I knew that there was a knowledge gap that needed to be filled. So that spurred me into founding My Child and I, because I believe that properly educating women, they can make more better choices, which will stop or reduce the deaths that we have in women and in children. Yes, so that was how it came about.
Wow. Wow. I never thought of it as a what made it um what makes it taboo though?
People believe that they shouldn't be cut open to bring out a child. Like
Ah,
The Hebrew women mentality is engraved. Even in this 21st century, you'll be surprised that you hear stories of men that abandon their wives at the hospital just because the doctor says she has to go through a cesarean section.
mm,
So the woman has to fund herself, has to go through the process herself. And they just think that if you don't deliver normally, you are weak, or
okay.
you are, yes, that it's just abnormal. So that's really something that we are still fighting in this part of the world. So
Wow.
yeah.
Okay. Okay. Understood. Understood. And ingrained beliefs are very difficult to shift.
Yeah.
Yeah. Wow. So that's a huge thing you're taking on. Good for you. And so the other one is called out tribe.
Yes. So yes, I got the inspiration, I think sometime late 2019, but I shelved it aside, but it came stronger last year. So because we know that in this day and time, teenagers, children are very volatile. Like that is a period in their lives where they are going through emotional hormone surge and different
Yeah.
things. They are exposed to drugs and all sorts of vices. But then there is a way to live, there is a proper way to live. And so I got that inspiration to just build a community where these children, these teenagers are taught God's way, how to live their lives according to God's standards and principles, and they can shine that light to the world and even make other people come into the light. So yeah, that's what we are doing, and God has helped us so far.
Those three huge pillars to you. You're a nurse, and you founded two different organizations, and you're a writer, and you're a podcaster. What do you write about and what do you talk about?
Okay, yes, I write about maternal and child health articles on our blog, yeah, on our Instagram. So yes, just educating women on pregnancy, labor, conception, and what to expect. And yes, I've been writing since I was a child. I wrote in the school magazine,
Mm,
articles, different
mhm,
things. So, yeah, but I'm
mhm.
more centralized to health articles now. So podcasting, I speak about different um, topics surrounding the Word of God. Yeah, it's an offshoot of the Called Out Tribe. So we have a
Okay.
podcast where we speak on faith topics. Yeah, just leading teenagers in the right way and how to act in the society, how they can excel in life, and just doing things the right way. Yeah, so that's what I talk about.
Well, you are one huge lady, my dear.
Thank
All right. So quickly, there are two things I want to ask you. First of all, what advice then would you give to someone who wants to be a nurse?
Okay, for someone who wants to come into nursing right now, I would want them to be sure that they want to do nursing. Yeah, to not just come into the profession because they heard it's lucrative or it's something that can get them where they want to be. Be sure that you actually have the passion, because nursing is not all rosy. It will shake you physically, mentally. So be sure you want to do that. And also, once you settle that, nursing is something that doesn't limit you. You are not limited as a nurse. So you are exposed to different specialties that you can go into. You can even be all that you want to be: a writer, an entrepreneur. You can go into law. We have nurse lawyers these days. We have
Mhm.
nurse tech nurses. We have, so nursing is broad and you can explore it to whatever length you want to. So that's one of the advices I'll give nursing, someone that wants to come into nursing today.
Awesome, awesome, awesome. And I want to ask you one last thing before we go. You do so much. What do you do for you? What do you do for self-care? What does it mean to you?
Okay, yeah, self-care is very important, and it means different things to different people. As nurses, we can get into the fix of taking care of everybody and not having time for ourselves. But for me, anytime I go through a long day at work, I just want to sleep. I just want to rest on my bed. Like, of course, having a good meal when I can. Sometimes it's just watching a movie. Sometimes it's going out to hang out with friends. Sometimes reading a book. Sometimes it's just meditating and being still. Yeah, so I usually try to find time to rest actually, because we need to rejuvenate and pour into ourselves as much as we give out. So yes,
Yeah,
that's what.
yeah. Yeah, we need to pour into ourselves. And I make a point of asking every nurse that because, again, as you say, we are so almost indoctrinated into taking care of everyone else. Very often we get lost and don't even realize that we haven't done not one thing to take care of ourselves, even just to nothing luxurious, just to take care, basic care of ourselves. Sometimes we haven't done that.
Yeah.
Haven't done that. Jadesola, before I let you go, is there anything you would like to leave us with? Any little word of advice or gem or story you want to share?
Okay, last words to fellow nurses, especially in Nigeria. You are not limited. Like I said earlier, you are not limited. You can do and be whatever you want to be. Yeah, right now nursing affords you the opportunity to explore. So don't limit yourself to the four walls of the hospital or to just nursing. You can go into law, you can enter entertainment and media, you can take up political positions to actually affect the policies, to make a point known in policies that affect us. So nursing does not limit you. Just be all that you want to be. Yeah, that'll be it.
And on that note, thank you so very much, Jadesola. I really enjoyed talking to you. Thank you so much.
Okay, so thank you very much, Ma.